Good morning. My name is Grace Boone. I'm from Indiana.
My name is Ran Qing. I'm from China.
Good morning. I'm Ruchi Hazray, and I'm from India.
Good morning, Jose Navarrete from Mexico.
Let me introduce Jen and Ethan. Ethan is 6 weeks old, and Jen has been breastfeeding since he was born. One day, she was out running errands, and it was time for her to nurse. So she popped into a coffee shop, grabbed a latte, sat down, and just as she started to breastfeed, the manager came up to her and said, "I'm sorry, ma'am, you can't do that here. You're making the other customers uncomfortable." What the manager said was actually illegal, but Jen was so embarrassed that she hopped up, ran out, and went down the street to another cafe. When she got there, she asked them, "Can I breastfeed here?" They said, "Sure, come on in." But then they directed her here. At this point, Jen was so tired and frustrated, and she had a crying, hungry baby, that she went home saying to herself, "Maybe breastfeeding just isn't for me." Jen is not alone. In New York City and across the nation, moms make the same decision every day. In New York City, 90% of new moms are breastfeeding when they leave the hospital, but by their baby's 8-week checkup, only 31% of them are. This is a huge public policy issue because breastfeeding has many benefits for babies, moms, the economy, and the environment. For babies, they have a 50% reduced risk of ear infections and an 87% reduced risk of hospitalization due to lower respiratory disease. Over time, they are less likely to experience asthma, lymphoma, and type 2 diabetes. For the moms, they are less likely to experience postpartum depression. They have a 4% reduced risk of breast cancer and a 27% reduced risk of ovarian cancer. These health benefits, added together, lead to a 10% reduced $10.5 billion. I'm sorry, that's a much bigger number, right? It's a $10.5 billion savings to the US economy. In New York City alone, that's $315 million. And the environmental benefits are no less impressive. For every child who is breastfed, we save 150 containers of formula from being consumed and reduce carbon emissions by 270 pounds. So considering the tremendous public value of breastfeeding, how can we help moms like Jen breastfeed for longer? Well, let's reimagine her story. What if instead of wandering down the street, wondering what business might accept her, she saw this? A decal in the window letting her know that breastfeeding is welcome. We are Latch. We have a simple solution that connects what nursing moms need to what businesses are willing to offer. Our concept is built on New York State's Civil Rights Law, Section 79E, the right to breastfeed. It reads, "A mother may breastfeed her baby in any location, public or private." The trouble is, many businesses don't know about this law, and those that do honor it so superficially that they ask moms to nurse their babies in unsanitary places like restrooms. That's why we make sure that businesses clear an initial hurdle. First, that they have a courteous staff that understand the right to breastfeed, and second, that they offer moms a place to sit that's not in the bathroom. From there, we assign categories of the other features the business might have. This is open seating, semi-private seating, private space, and an outlet for pumping. Businesses are then given a level depending on the number of features they have. A level 1 business meets the basic commitment and then has one other feature: open seating, semi-private space, or private space. A level 2 business has the basic commitment and then 2 features. This would be open seating and semi-private space, or private space and an outlet for pumping. Level 3 is really the goal. This is when businesses have multiple features that can be mixed and matched depending on the needs of moms. So let's go back to Jen. Let's say she's out and she needs a private space with an outlet for pumping. Lucky for her, there's a level 2 business nearby that has these features. Using our easy decal system, she can identify the business, and we've matched what she needs with what the business offers. This is incredibly important because there's a tremendous stigma around breastfeeding in public. In a recent survey, 57% of Americans said that breastfeeding in public was unnatural, indecent, and wrong. That's why 40% of new moms say that nursing away from home is their greatest concern. We want to change the dialogue and make this easier for moms like Jen. And we're going to do this in 3 phases. Phase 1 is about building our network of businesses. We are in 3 neighborhoods, Murray Hill, Tribeca, and Greenwich Village. They all have a high concentration of families with babies. We'll be assigning them their categories, getting them their decals, and making sure they're ready to welcome new moms. Then we'll be building awareness, working closely with strategic partners, their medical centers, online parenting communities, and the brands that moms trust. I'm excited to say that we already have conversations happening with Montefiore Medical Center, MommyPoppins.com, Infamil, and Babies R Us. These companies understand that the Latch initiative fits in well with their brand values. We'll be working with them to have offline and online communications activities. Offline activities include our window decals and distributing promotional materials and brochures. Online activities include active participation in social media and purchasing targeted and low-cost Facebook and Google ads. Phase 2 is all about growth. We'll be expanding into new neighborhoods and building a strong mom community who can drive this growth throughout the city. Phase 3, this is when the magic happens. This is when we change the dialogue throughout New York City. Now, I'm about to show you how our simple and small idea can change a big city like New York. But that's going to mean showing you some pretty big numbers, and before I do that, I want to walk you through the simple and conservative assumptions that got us there. So as I said, we're starting in 3 neighborhoods. And each neighborhood will have just 1 volunteer, and that volunteer will just need to bring in 1 new establishment each week throughout the year. So that's 3 times 1 times 1, that's 3. Times 50 weeks in the year, that's 150, and we'll have 150 establishments in year 1. Year 2, the only assumption that changes is the number of neighborhoods. We're in 6 neighborhoods now, so 6 times 50 weeks in the year is 300, plus the 150 establishments from year 1, that's 450. We have, assuming a 10% attrition rate, that's 45 businesses, so 450 minus 445 is 405 establishments in year 2. Using the same formula in year 5, we're in just under 4,000 establishments. And the growth over the years is pretty impressive. I mean, wow, right? And we think this is very doable. We actually have 8 establishments committed to working with us in just the last 3 weeks. And the number of mom visits that happen over the years is equally impressive. And in year 5, using a similar calculation, we estimate that we'll have over 1 million mom visits in that year. We came to these numbers working closely with our advisory board, who have expertise in lactation, entrepreneurship, baby formula sales, and motherhood. So how much will it cost to make this happen? Our budget for year 1 is divided into 3 categories: community management, materials, and overhead. And the total is just under $23,000. I'd like to call your attention to the amount that we're spending on community management. We are a community-driven solution, and this means having feet on the ground and people talking to businesses and building relationships with moms. We're putting our money where our mouth is and devoting 68% of our first-year budget to these activities. And another impressive number is our social return on investment. For every dollar that's spent in year 5, particularly because we're such a low-cost endeavor, we return $138 to the community. So how will we measure success? First is raw numbers. There's many metrics we could use, but the 2 most important will be the number of moms who are served by our initiative and the number of businesses that are working with us. Second is awareness, and we'll measure this by the buzz created through our offline and online activities. And our city impact will be measured by the change in the dialogue and the increase in the moms who are breastfeeding. This impact is already happening as moms like Jen and babies like Ethan are able to enjoy the city and enjoy Latch locations. We are Latch. We believe that breastfeeding is an important public policy issue. We have a simple solution that connects moms to local businesses, and our community is New York City. Thank you. We're now happy to answer your questions.
I have a question. I think I might have been the one not talking in the microphone earlier, so I'll resonate in there. I can see how this would bloom and catch hold in a term they used when I was your age was a yuppie neighborhood. I don't know if that's still a term you use or not, but we're going to use it. My question is, how do you get this to take hold in a transitional neighborhood or a lower middle class or a poor neighborhood? How do you get this to go there? Because all the more reason for the need to breastfeed in an area like that. How do you get that to catch hold there? How do you get the volunteer? How do you get the businesses where there may not be a lot of businesses, package stores and convenience stores?
That is absolutely a very important concern, and that's one of the reasons why we'll be reaching out to a wide range of establishments, everything from coffee houses, which is admittedly pretty yuppie, but also nail salons, laundromats, and even public libraries, so that we're in spaces that are frequented by a wide variety of moms, regardless of income level.
So you said you'll depend a lot on volunteers, which I think is great, and I think with this cause you'll have a lot of volunteers, but can you talk a little bit more about the budget that will go towards volunteers and how you'll train them, and if that will be you training the volunteers to go out, and what sort of training you'll give people to go and speak to businesses?
Thank you for your question. We actually, as my colleague Grace mentioned, we're going to spend 68% of our first-year budget in our volunteer force. So this includes providing them with unlimited subway and transportation cards that allow them to reach businesses all around the city. We actually plan to work with mothers groups as we believe they are a motivated volunteer force, particularly for the focus of our project.
But then those volunteers will also go to businesses to recruit them.
Yes, exactly. That will be the main role of the volunteers. The volunteers will go out to the businesses and they will provide the information. They will bring the promotional material. They will bring the flyers, the brochures with all the information for the businesses. It will be a training process as well for them.
So two issues for me. One is that, as you point out, this is legal. It's required. So basically, you are doing the work of the New York State or New York City or whichever is the regulatory agency. What kind of response have you had from them or cooperation from them? The second issue I have, which I had raised earlier with you, is that have you at all thought about going to larger establishment, such as Starbucks, so you would have a great coverage, and also that they are far more worried about their image than a, say, small mom and pop?
Thank you for your question. So the first question of have we talked to the city government, we have not as of yet, but that is definitely on our list to do, and it's an excellent suggestion. So we'll be doing that. Our focus up until now has been to enlist the community and double checking and reaffirming our assumptions that there's a demand for this in the community and businesses are willing to go with this. So we will definitely be enlisting the city government going forward. The second question around going with the bigger chains, absolutely, we definitely want to do that. We do also want to maintain a focus that there's a diversity in the establishments themselves. So to Mr. Gregg's point earlier, that moms from all income levels are able to access these locations. But for the purpose of visibility and publicity and just sheer infrastructure presence in New York City, we will definitely be targeting the bigger establishments as well.
Mm-hmm. Well, I think that raises another issue, which is to say that if you had not approached at all the regulatory agencies or the agencies that are in charge of making sure that this happens, many a time the attitude of these agencies have been about this kind of citizenship involvement as busybodies. Retired housewives who don't have much to do, they get engaged in stuff of this sort. So what kind of preparations or anticipations do you have about, either negative or very least enthusiastic admission of the proposal such as this?
Sure, I definitely know that some of our policy officials in New York State and New York City are not thrilled about some of the rabble-rousing community members sometimes. I think one of the preparations that we've made is making sure that we do have businesses on board, talking to moms, talking to the community, and knowing that this is a demand within the community that's not currently being met by the regulatory framework. And we're remaining hopeful that the policy officials in the Department of Human Rights and the Departments of Health, both state and city, will be excited to work with us and see how our initiative can dovetail with the other ways that they've promoted breastfeeding.
Great presentation in terms of setting up the problem statement, but one of the things that you've said is the remarkable decline over the first 8 weeks of a newborn in breastfeeding commitment, really. And you talk about the 40% of the mothers who cite privacy or the ability, the public perceptions as a reason for, or they're concerned about the public perception, but that doesn't necessarily mean that's the reason they quit. What else have you done to look at some of the other factors that result in the mother deciding not to breastfeed and what impact they may have? And what can your initiative do to help support those problem areas as well?
So in our research, we found a national study from 2011 that said that the top 4 reasons that moms stop breastfeeding is first, fears not having a good initial breastfeeding experience, fears about the child's nutrition, going back to work, and then fears about breastfeeding away from home. We feel that our initiative very specifically addresses the last 2 because we're uncovering spaces that moms who are returning to work can be able to pump. New York State and federal law both provide moms with break time to pump while they're at work, while also making sure that we're meeting the various needs of moms across the privacy spectrum for moms who are with their child and are nursing while they're away from home.
I was shocked to see the numbers of people. 57% said wrong, whatever. I'm probably the one person in here that I live on a farm. I mean, my kids, as I did, saw animals born. We've milked, see nature on a daily basis. My wife, who's not here, fed livestock yesterday, and we're getting ready to have pigs. I know that's foreign to most of the people in here. That amazes me. It's that high. What do you have to do in that line? Are some of these cultural? Are some of these cultural that you don't do that in public? As a farm kid, I grew up seeing animals do this, and I saw people doing it. So I guess, is this something culturally also? Is this something that there is a stigma attached in some cultures that they don't do this in public that I'm unaware of?
Yeah, absolutely. And as you see, we come from very different countries, and Ron and Jose and I were saying the same thing. And back in our home countries, there isn't that stigma. So it is definitely
There is not that stigma.
There is not that stigma, and it is definitely a cultural thing. The great thing about our solution, though, is that that stigma only really comes into play in the open seating area of it. In the private and the semi-private, it isn't as relevant. That said, that's really like what Grace said, that's really where the magic happens, because we do want to erode that stigma one mom at a time, one establishment at a time, even though we think establishments would definitely self-select for that option. That's what we want to do with this. Breastfeeding has been a private issue for too long, and we think it's time to make it a real public issue, because it is, for so many reasons.
Good.
Thank you.
Are there other questions?
We have other questions, but you don't want them.
Take them.
We'll take suggestions too.
Well, okay, if you want questions. Can you tell us a little bit more about what you imagine in the future? I know we had a couple-year plan there, but I know we talked a little about like building an app or things along that. Everyone wants to talk about it?
Yeah, sure. Thanks to your question. Actually, our initial plan about this is about to create an app, but we realized after talking with a lot of faculty, and we realized how to really bring it up is to really fit on ground, to talk with the business, to build our network. This is the first step, and this is very important for the future plan about the app. And we also talk about this because this is doable and this is happening. We already get 8 businesses. So in the following year, we are all first-year students. So in the following year, and even after graduation, we want to do it. Yeah, it's happening. Thanks.
So if you have time, I would like to ask one question. So as you were doing this work, where did you find the resistance? For example, take your own university, NYU. Do they have facilities like that? Government, city government, do they have facilities like these before you even go outside to commercial establishment?
That is a really wonderful point. NYU has a few spaces throughout our kind of sprawling campus in Greenwich Village. The city of New York has very few spaces. So in the city government complex in Lower Manhattan, there's actually, I've been told, only one lactation room. So new moms have to go all the way downstairs and over several blocks to get to that space. So we definitely want to address that very soon.
So in terms of where do you think you would have your work cut out? Where would you concentrate most?
So I think just in a strategic kind of way, we do want to tap into the low-hanging fruits, and oftentimes those are the local establishments, because we want to make our presence known, and the window on the decal is a great way to do that. So we will definitely be tapping into those low-hanging fruits, but that said, we do want to target these big corporations, big institutions, that especially ones that should be providing that service because that's the law, and they're the advocates for the law. So we will definitely do that. So I guess it'll be a two-pronged strategy to tap into the low-hanging fruits, but also keep an eye towards the long term and getting some of these very critical organizations on board.
Thank you.
Just, I do a lot of contributions on TripAdvisor because I travel a lot, and I've been amazed with that technology because I was recently in Southern California and I had breakfast in one place and did a review, and had lunch in another place and did a review, and then it emailed me and told me that perhaps I wanted to try dinner at this place, which is right near there. So that the technology, I guess, sort of the interactive capability of this, you could probably even approach someone like a TripAdvisor and have the same kind of situation built into it, so that because you talk about the and I forget what you called it, the social investment that happens here with the firms, because sort of going on Dr. Gandhi's recommendation that you talk to the local governments and the state government, but really doesn't your product really key on the fact that there's something in it for these local establishments as well, and what is that?
Yes, there's definitely something in it for the local establishments, and I think that's at the heart of why it has taken us, honestly, one conversation to get them on board. And what's in it for them is a two-pronged thing. One is it allows them to promote social responsibility and engage in the community, which a lot of them are looking to do, and they understand that is directly related to their brand image. Even if you are a small coffee shop in the corner, if people know you as a family establishment in the neighborhood, contributing to that neighborhood, it definitely adds to their value. And the second thing is what we're offering them, especially these small coffee shops and small businesses locally, is their free marketing. We're getting the word out on the fact that they exist on this little corner, and that they're supportive of their neighborhood. So those are the two very concrete things that they get by partnering with us.
Thank you.
Thank you. Thank you very much. We're Latch. We have a simple solution to make breastfeeding more possible. Thank you.